In this video, we'll be covering the Yersinia genus. Specifically, we'll be covering two organisms, Yersinia entericolytica and Yersinia pestis. This scene will take place at a pet shop. We're going to name it Yerson's Pets, which sounds a little like Yersinia pestis, and it's also in honor of Alexander Yersin, the Swiss-French physician who discovered Yersinia pestis, the cause of the Black Plague. It's a little known fact that Dr. Yersin used to sell pets before beginning his historic medical career. In fact, it's so little known, you won't see it anywhere else besides here. Notice we're using a lot of red and pink hues. Well, this is because Yersinia is a gram-negative organism. We're going to talk about Yersinia entericolytica first, then we'll move on to Yersinia pestis. Yersinia entericolytica will be centered around this puppy cage over here on the left side. Let's write English Terrier, which sounds somewhat like entericolytica, and draw this little English Terrier in the cage. You'll notice two things about this puppy. First, it has no hair. This isn't meant to help you remember anything, and quite honestly, I have no idea why it's naked. It's pretty gross. Maybe that's why Yersin didn't stay in the pet business too long. The second thing you'll notice is that it's pooed all over the place. This is also a little gross, but at least it means something. The reason we did this is to help you remember that Yersinia entericolytica is primarily transmitted through puppy feces. Examiners may put this in the patient's history to help clue you into Yersinia entericolytica infection. Since it's transmitted commonly through puppy feces, you can probably guess who the most common infected demographic is. That's right, dirty little kids who play with puppy poop. This should be pretty easy to remember, but we'll add a toddler to this story just to help you keep it in mind. Another reason toddlers are commonly affected is because Yersinia entericolytica can also be transmitted through contaminated milk products. To help you remember this, we'll give our toddler here a baby's bottle with milk in it. Another bacteria that likes to contaminate milk products that we've learned about is Listeria. And a lot like Listeria, Yersinia entericolytica is also resistant to cold temperatures. So we'll use the same symbol we used to represent Listeria's cold resistance. Remember those icicles shown outside of the window of the Christmas scene? Well, we'll use the same icicles on this pet shop and have some of them forming outside of the windows here. Before we jump into the symptoms of this type of Yersinia infection, let's cover a few more identifying features. You already know that it's gram-negative, but you should also keep in mind that Yersinia is often described as having bipolar staining, which means it stains most heavily on two ends, which makes it look a lot like a safety pin. So to help you remember this bipolar or safety pin staining, we'll put a safety pin on the toddler here. You should also know that Yersinia is encapsulated. We'll use our recurring capsule symbol, the glass capsule, and we already have something here that kind of looks like a glass dome. We'll just turn it into that glass capsule symbol you're already familiar with. So the main symptom you need to know is that Yersinia entericolytica causes diarrhea. The diarrhea is often invasive, resulting in blood in the stool. So to help you remember this bloody diarrhea, we've conveniently placed our toddler on a stool, which is our symbol for diarrhea. And to help you remember that it's bloody, we'll color it red. Since Yersinia is invasive, it can cause systemic effects as well. This includes fever, leukocytosis, and abscesses. Specifically in the abdomen, infection can lead to intestinal perforation, intussusception, paralytic ileus, necrotic small bowel, and pretty much anything else you can imagine happening in the GI tract. These are all possible, but pretty rare. The one main manifestation you should remember for your exam is that Yersinia can mimic appendicitis. So if you see a toddler with right lower quadrant pain and other classic symptoms of appendicitis, such as fever and elevated white count, pay attention to the history. If there's any mention of playing with puppies or other sick kids at the toddler's daycare center, you'd want to keep Yersinia entericolytica in mind. To help you remember that Yersinia can cause this pseudo-appendicitis, we're going to have this English Terrier licking the right lower quadrant of our toddler here. That's really all you need to know about Yersinia entericolytica, so let's move on. Alright, now let's cover Yersinia pestis. Yersinia pestis is the cause of the infamous Black Death, or bubonic plague, one of the deadliest pandemics in human history. It killed up to 25 million people in the 14th century. That's more than 1/3 of the entire European population at the time. So let's talk a little bit about how this plague was transmitted. Humans are actually the incidental host of Yersinia pestis. The main reservoir is rodents, classically rats, But in more recent times in the US, the main reservoir is actually prairie dogs. So how exactly do humans get this infection? Well, it's not the rodents that spread it, it's the fleas that bite them and then bite us. To help you remember the main reservoir, we're going to put a cage here that says rodents and put a prairie dog inside of it. So to help you remember that fleas transmit the infection to humans and act as a vector, we're going to put a sign here on the wall for some flea spray. So we mentioned earlier that Yersinia pestis causes the bubonic plague. Well, the reason it's called the bubonic plague is because when people get infected, they form these characteristic buboes, which are swollen, tender lymph nodes. Let's draw a guy here buying Yersin's anti-flea spray, and we'll draw some nasty-looking buboes on him. So once Yersinia established infection, the bacteria rise to higher and higher concentrations and get into the bloodstream, and they cause more serious diseases such as abscesses in organs, and even DIC and cutaneous hemorrhage. The DIC is caused from endotoxin and can even lead to necrosis of digits and other appendages. This blackening and death of tissue is probably where the name Black Death came from. There are also some other virulence factors, such as exotoxins and Yersinia-associated outer proteins, or YAPs. These YAPs cause macrophage and neutrophil dysfunction by inhibiting phagocytosis and cytokine production. This allows the organism to replicate rapidly and spread. You should also remember that these YAPs are secreted by a type 3 secretion system. We'll use a recurring type 3 secretion symbol, the turkey baster, to help you remember this. Let's give it to this worker here, and he'll use it to fill up the prairie dog's water. Okay, now that you know all about Yersinia pestis, let's move on to treatment. Aminoglycosides such as streptomycin in combination with tetracycline has been proven as an effective treatment. To help you remember aminoglycoside, we'll use a recurring symbol, the psi. Let's give it to the other worker over here, and he'll use it to pick up the puppy feces. That's a pretty awesome pooper scooper. To remember tetracycline, we'll use a recurring symbol. We'll give this prairie dog a mouse wheel to run on, but instead of being a mouse wheel, we'll make it look like the recurring tetracycline bicycle wheel. Finally, there's a killed vaccine that can be used to prevent Yersinia pestis. And it's not really routinely used, so it's not really routinely tested, but we thought we'd include it here for completeness. We'll put a poster on the wall to help you remember this. It'll say, "Vaccinate your pets before they are killed," with an emphasis on the killed, because it's a killed vaccine. And that's it for Yersin and his pets.